Okay, hi Devin, it's Dr. Buford. We're just getting started on your left knee. We're looking in the medial compartment or the inside of the knee. Go to 60 on that. And this is the medial meniscus right here. As we slowly extend the knee, we'll get a look a little bit more posterior. But so far, this medial compartment looks pretty good. Right now, we're just flushing a bunch of salt water through. And so here you can see the posterior horn of the medial meniscus. Come on this side for me so you can tell me a little bit. And this anatomy is all checking out pretty well, just right there. Just keep it from coming above the post. Just keep the, yeah. That looks pretty good there. As we flex the knee down, we can see the cartilage on the femoral condyle. That looks pretty good. I'll show you some more in just a minute. Okay, so now we're looking in the central part of the knee. This big, strong-looking ligament is your anterior cruciate ligament. It looks just fine as it runs up and fills up the lateral aspect of the intercondylar notch here. That looks good. Behind this little fat pad would be your posterior cruciate ligament. No signs of any problems there. And in just a minute, we're going to look in this lateral compartment. Get a first look here. And at least on the initial look, the meniscus looks pretty good, as does the cartilage. So we're continuing our evaluation of the lateral compartment. This is the posterior horn. And all the while we're flushing salt water through the knee. This looks pretty good back here. And as we slowly move around towards the anterior, we can see the popliteus tendon back there. We'll move a little bit more anterior to get a glimpse at the anterior horn, and this all looks good. I don't see any significant chondral lesions, so I'm happy with that. I'll take this. We're going to look at the patella next, and we'll show you some more in just a minute. Okay, so this is the medial gutter in the knee. Just keep the knee kind of rolled just like that. And as we look down here, I'm not seeing any significant problems here. If we look all the way to the right, we're just seeing the medial edge of the medial meniscus there at the meniscocapsular junction. This anatomy all looks pretty reasonable here. We'll pull back a little bit and have a look at this patella, which is going to be at the top of the screen. And there we can see our first signs of a little bit of trouble here. You can see how the cartilage underneath the patella is a little bit softened. And that's where loose pieces get generated from quite typically here. So as we look down the front of the knee, we'll look at the trochlea as we come down in the front of the knee, and this looks pretty good. But as we get up to the patella, we can see where the problem is right there at the top of the screen. So we'll keep working here, show you some more in just a minute. The lateral gutter, that's where the loose bodies are. Here's one of them right out of the gate. Our first look in the lateral gutter shows us this loose body. Okay, and so we'll go on a little bit of a hunt here and get that removed in just a minute. But I just wanted to show you that before we remove it. Sometimes just the suction will bring it to the shaver. Sometimes you have to get a grasper on it. Either way, it's going to not be in the knee when we're done. Okay, there's one of them, another one. There's several. And again, typically these come from that cartilage injury underneath the patella. Okay, so we've got one of the bigger loose bodies in our grasper here. We're just going to remove that out of the knee. And now we're going to look down even farther in this lateral gutter, see if there's anything else to worry about. And all the way down here, it looks pretty good. Okay. So we'll turn on the suction. This will help us determine if there's anything else that's loose. But as we bring the suction over to this lateral side, nothing else is coming into the shaver. So I think we've got all the loose bodies removed now. We're just making sure we're flushing everything out. Okay. And then we'll finally focus on this patella, get this as smooth as we can. I don't like using heat on this because it can damage areas that we can't see, so we just use mechanical debridement most of the time just to make this as smooth as we can. Now this is an area where we've talked about orthobiologics in the office. This is definitely an indication for whether it's PRP or a stem cell injection to see if we can't get this cartilage to recover as much as possible. There's some data suggesting that we can help this process, help slow this process down, and maybe even arrest it by doing one of our orthobiologic injections. We just want this area to firm up and to not generate any more of these loose pieces. And so now that you've already ended up in the operating room, it might make sense to try and go for the home run and prevent these areas from generating any more of these loose bodies, because we want to keep as much of this cartilage as possible. So you can see I'm going to stop here, but you can see how it's still a little bit soft, but I don't see anything that's about to flake off or chip off, so I think I'm going to stop here. Anything else that you decide to do in terms of an injection, we can do in the office. And now we have a good look at it, so we know exactly what we're dealing with here. It's a slightly lateral lesion. Here's the midline right here, so it's slightly to the lateral of midline on the patella. Okay, so I think we're going to be finishing up here in just a minute. I just wanted to get one more look in the trochlea. Sometimes there's an additional lesion down here, but here I can see all the way down to the notch, and I don't see any more injuries to the cartilage here. So very good. We're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.